what we are going to talk about, which is social infrastructure, it's not as simple as it sounds. And, I mean, a bit like agriculture, like where the concluding note was that enable people rather than, keep feeding them. I think this is the broader theme that social infrastructure building should be about. And, to start off, I wanted to first get a sense of you of, like I did with the previous session, get a sense of where we stand in terms of, for instance, history tells us that since in the industrial revolution, most countries that have done consistently well are those that made sure that their women and children had good health and education access. And we were talking to the Economic Advisory Councils, to the PM. The chairman was here yesterday with us, and he said this is an issue that we have sort of struggled with. Health and education, quality and quantity, is something we've struggled with since independence. And clearly that has cascading effects on the societal aspects and the way we deal with the economy and sociological problems. So I wanted to first get a sense from the three of you on what your assessment of the journey since independence in this on this front, and before we look at how to go forward. So maybe Ms. Vyas, you want to start off?
Yeah, thank you so much, and thanks for having me, and really appreciate my panelists as well. I'm looking forward to learning from them as well. From my perspective, the sectors are not necessarily social sectors. Foundation, this is the core work that we do, which is investing in health, education, nutrition, sanitation. For us, these are core sectors. These actually are critical for human capital. If you look at India, India is fifth largest economy, going to be the third largest. We are on track to be the third largest. And an economy that is of that scale, it is important, it is essential that human capital and these sectors are understood as core sectors to be invested in. You've spoken about the trajectory in terms of progress. It's been pretty phenomenal. If we look at maternal mortality, if in around early 2000, maternal mortality was about 300 per 100,000 live births. That's how it's tracked. It is at 95 right now, similarly, or 95, 97. Similarly, under 5 mortality from 90 to 30. If we look at education, work that Ashish closely looks at, primary education is almost universal. Sanitation, if we look at sanitation, it was about 40% in 2014. Absolutely exceptional when it comes to trajectory of sanitation coverage. It is phenomenal in terms of I would say in terms of modern history, it's been pretty phenomenal that it is rural sanitation is almost universal. So there has been tremendous progress. I would say that what we used to speak about, that there has to be access as well as quality of access as well. I think the access to a certain degree over the years has been addressed. Of course, there is still issues of tuberculosis. We still have India has quarter of world's burden when it comes to even NCDs. The deaths are really coming from non-communicable diseases. So there are challenges, but at the same time, I think broadly access is moving at its pace. It's the quality and resilience that matters, and I think the future would be more in terms of how do you get to that quality. Because if you think about, you will be, in terms of ranking, you will be the third largest economy, and you can't have outcomes and indicators which actually are still trailing, right? A lot of investment is going from the government. A lot of investment is going from the private sector as well as philanthropists like us. But we need to accelerate the pace of quality and resilience and the future outlook. I'm sure that you're going to be coming to that. Yeah, thanks.
So thanks for inviting me to the panel, and I look forward to hearing the views. I'll take off from where you left, which is in terms of as the fourth largest or third largest economy. Have the citizens felt it over the last 7 decades? And the clear answer is no. The divide between have and have-nots has only increased as an economy has grown tremendously, done extremely well. That means the rich has become richer, and the divide has become wider, and therefore the social infrastructure of health, education, basic health and hygiene has not kept pace with the country growth and the economic growth. So that's the first part of what I call facing the reality. Has it improved? Yes, it has improved leaps and bounds, but it is not a reflection of a fourth largest or a third largest. Yes, there are constraints of population, geography, and where we're coming from. I think the second issue which we need to look ahead a bit and saying, is there a crisis in the horizon or is there a hope on the horizon? And I tend to see a crisis in the horizon. Uh, Thanks to AI coming in, the kind of jobs which IT, pharma created, that is going to get challenged. And therefore, if jobs are not there, economic growth, individual growth, and therefore dependence on government-linked social infrastructure support is going to become far more. And therefore, what do we need to do to address that? That's the second issue. And the third is, do we have the innovation and the ideas to transform the social sector? Education and health are two areas which I extensively work with. Sampak Foundation works with about 2 crore children in 2 lakh schools. In health, we are building hospitals. And I think the gaps are so large there that incremental thought and incremental ideas will not help solve them. And therefore, we would need some amount of disruptive thought, which created the pharma, which created the IT industry, equivalent to try and solve them. So the summary argument is that the social infrastructure is improved, but it is not where it needs to be. The crisis ahead of us is larger than I think we are anticipating. And the innovation required to handle both the past and the future is not visible right now, and that is where we need to make the investment.
No, again, thanks for inviting me. I'll echo what Vineet is saying. I think we've made a lot of progress economically, but I think some of the social indicators we are behind on. Now, I think it's but natural. I think when you're trying to take development to the bottom half of India, it is easier to build rural roads, take electrification, sanitation, and we have to give the government a lot of credit for at least getting some of the hard infrastructure to places that didn't have it earlier. The challenge with education and health is that they are much more complex. You can't just string a wire and turn up on a power plant and get electricity into that's easier, or build a road. With education, you have teachers who've been recruited, who are teaching a certain way, and you now have to get them to do something differently. So unless the teaching learning improves in the classroom, your indicators are not going to improve. You can collect better data, you can put in more infrastructure, you can put in fancy equipment. It won't necessarily turn the needle. So I think the government has struggled with that over a period of time. The massification happened, as Archana was saying, but quality has not improved. I think health, I know the health people don't like to hear this, but is a bit easier because there are some things like, science helps when you have vaccinations and you can really improve infant mortality quite dramatically. And there's a lot of research that's been done in health around what the major causes are of infant mortality, maternal mortality. And, foundations like the Gates Foundation are very scientific and have gone about it very strategically and methodically in a manner to help state governments improve. And there has been a lot of improvement. Education, I think because of that last mile issue, the middle management, the teacher, I think it is fundamentally more complex. There is no silver bullet. There is no vaccine to deliver. And that makes it really hard. Having said that, I do think that at least in the early years, which is where we've done more work, with the Nippon Bharat mission, there is a greater focus on, teaching learning in grades 1, 2, and 3. We've seen a slight improvement in learning outcomes across the board. And look, it's a slow moving indicator. I don't think you should expect miracles. But I think if that sustains, then we've got a good thing going, because over the next 10, 15 years, you could actually see, as opposed to 55% of children being left behind, hopefully 25% of children are. Even that's not good, but I'm being a realist. Hopefully we manage to bring it down to 25% of children being like 75% of children actually having a chance in life. Now, AI and all is different kind of disruption, and you have to look at the job market and where jobs are. But I think certain fundamental skills all children should have, irregardless.
I think while, like you said, education quality outcomes like you rightly said, education outcomes have improved at certain levels. But we've also had this period of the pandemic where there were a lot of learning losses, and I think some of those accumulated learning losses will keep biting us. It may not show up while your child was in class 5, but in class 9, it will still show up that he didn't grasp that basic concept well. So is that a concern? And secondly, there's an attempt now by the CBSE to introduce, starting from this academic year, AI subjects from as early as class 3. Now, is that something that Mr. Dhawan, maybe you can give us a sense of whether is that at least a good start, and of course it probably needs more supplementary efforts to get children familiar with the AI rather than just a textbook sort of approach.
See, in education, lots of new things are happening. You referred to AI literacy, for instance. So there is Central Square Foundation has worked on something called AI Samarth with IIT Madras, because they have a school of AI, Professor Ravindran, on developing a curriculum that some states have now taken up, and hopefully it'll become a national movement. There, the focus has primarily been on class 6 to 12. Because when we look at children, we just did this Bharatway Tech survey, where you see that 90+% of households have a smartphone, 57% have 2 smartphones. 2/3 of children are actually using the phone for some form of learning. The primary use case is entertainment, but they are now starting to use it thanks to COVID. They got used to the idea of, watching videos, tied to the curriculum, etc. So I think they're anyway going to be on devices. So getting them to be AI literate is important for their own safety, but also because, they will become creators using AI tools as well. And they need to be aware of the risks. They need to know how to use these tools, etc. Grade 3, I think the Chinese are doing this starting grade 1. So I don't know. Others will know whether it's a good thing to start in grade 3 or grade 6.
Right. Mr. Dai, any thoughts?
Yeah, so I think this is a little complex, and let me try and approach it from various angles. I don't know what the right answer is, but let me share the angles, given the fact that we work in 8 states. So Haryana did a recent survey, which was very interesting, across 5 lakh children, where Sampak Foundation was involved with mathematics, and the grade-appropriate learners were 76% in grade 1 to 5. And in Hindi, where they did not use the AI technology, grade-appropriate learning was about 32, 33%. So, for the first time, we are seeing independent assessment done by the state showing technology intervention does matter. But the word of caution here is the fact that when COVID happened and people were dying around us, we did not release the vaccine till we tested it. What we know from an AI point of view, and given the fact that I've spent 3 decades in technology, I understand this pretty well, that it self-creates, it hallucinates, it manipulates, it lies. It does a lot of good things, but it also does this. Now, the emphasis of putting AI in the hands of children and farmers is something I'm very concerned about, without having human tested the implication of this, because as you said, the learning loss in COVID time is going to be visible in a few years' time. The impact of AI in front of the child without a governance layer, having not human tested, is something we will feel a few years down the line. I don't know whether it's good or bad, but all I'm saying is it's not human tested. So on one side, we have a learning problem, and there's a clear indication of the fact that technology potentially is the solution of a big problem. On the other side, we have to be a little bit more cautious of implementing technology without testing it. So at Sampak Foundation, what we have done is we have brought AI in the interface of the teacher and technology and not the child. And we said, let's keep the child away till we learn it. And therefore, we have digitalized 50,000 classrooms where the teacher gets resources, gets the AI nudge. And for the first time, we are getting data from 8 lakh classrooms on a daily basis, which we are giving to BRC, CRC through our AI nudge engine. Which is helping them transform learning. So we are attempting AI at that level. The last point I'd like to say from a curriculum point of view, I think coming from IT industry, I like to say the following. We are in the IT industry wrong stepped right now, right? Over the next 5 years, the skills which we have, which is largely coding, let me just go back to the industrial age and go forward. What happened in the industrial age was the fact that we were able to break a process down into what we call microprocesses, whether it is manufacturing or it is IT software development, because of which the skills which we needed in the industrial age were not the holistic skills, but micro skills. So somebody will do testing, somebody will do analysis, somebody will do concept design, somebody will do documentation. That all is now being taken over by AI at a very fast pace. So therefore, those skills are not needed. And therefore, the skills which are needed are conceptual skills, curiosity skills, ability to conceptualize. And that skills Indian IT doesn't have or not developed. And therefore, at Indian IT level, we are thinking, okay, how do we accelerate development of skills of conceptualizing problem, documenting it, and then going to technology to solve it? Because technology is only 20, 30% of the problem. 70% is conceptualizing what is the problem to solve and how to solve. Now, if you take that back to the school and saying, okay, what do we need to teach? I don't think a curriculum on AI tools is the right answer. I think we need to recalibrate and rethink about how do we do this. And one of the experiments which we're doing, which is very successful, is the experiment of half stories. So we in our schools tell half stories and stop the stories in between, and then tell the teacher to help the children imagine what this next level of thing is. So curriculum which is designed to help people think, ideate, problem solve is going to be far more critical than the skill. And the last point I'd like to make is you must understand with Chat GPT, one thing fundamentally has changed is what I call the UI interface. So therefore, the UI interface has become so good that the consumption of technology doesn't need understanding of technology. And once you understand that, therefore, when the curriculum is designed for future, should the curriculum be technology focused? I don't think so. It needs to be richer, and we need to think differently about modifying that curriculum, and implementing that scale for 15 crore children is going to be a materially different challenge. And that's the way we have to think.
Right. Yeah, Mr. Dhawan, you want to come in? Sorry, Mr. Vyas.
Yeah, I was talking more about AI literacy, but I think the real opportunity of AI, one is reimagining the curriculum. I agree, 21st century skills, critical thinking are important. But essentially, the opportunity is every child now has the possibility to have an AI tutor. Which if you go into any classroom, even a grade 3 classroom, you'll see that there's 5 grade levels sitting in that classroom. It's very hard for a teacher to teach. And in India, of course, you have teachers often teaching 2 grades at the same time. So I think what AI allows now is hyper-personalized learning. Many tools have now integrated it. They've been piloted. The evidence is actually quite strong. Whether you look at RCTs, different studies. Now it's a question of finding the pathway to scale with these tools. And some of them are have got reasonably good pathway to scale as well. The assessment bot that Convigenius has been running in about 15 states. They have 150 plus million data points already that they have. So, and there's very good insights on where learning is breaking down, right? But not only can you diagnose the problem, you can also give children the right learning tools then as a result. And similarly, we've been piloting a teacher coach as well in Uttar Pradesh. And basically the teacher leaves her smartphone on to record as she teaches, and the AI can give you feedback. And of course, you keep improving the tool as you go along, but the engagement is quite good. People find these kinds of tools to be quite useful. So I think we're still in the early days. I agree with we need a governance layer here. We need evidence. We need some standards before we take this to any degree of scale. This is a good time to tinker, to come up with tools, to pilot, to build the evidence. But before it goes to scale, some of this needs to be put in place.
So, a few years ago, free basic came in, and the idea was that we should give free basic to everybody just because it is free. Unfortunately, the government got influenced by some of us and saying that's a bad idea. Same is true, if there is water is not there, give Coke. At least they have something to drink, and we do not understand the implication of it. So I completely agree with Ashish, is the fact that AI gives us an opportunity of solving a problem which is not solved. But I'm not as bullish that we should, Ashish also says we should not go ahead without testing, which is, I'm not as bullish about it till some amount of structured human testing takes place. At the teacher level, absolutely yes. At a child, and I'm also talking about at a farmer level, be a little cautious. And it is not difficult. We can put some testing in place, test it over a year, and then accelerate. But before you get sucked into the fact that everything about it is good, just do human testing because it will impact generations and generations. I'm not saying there is something wrong with it. I'm just saying do not implement it without human testing. Just put couple of $1 million to do human testing. If everything is fine, go for it. In US, it is going a different direction. They are launched what we call 2-hour schools. And in 2-hour schools, they are giving an AI to every child, and they are saying within 2 hours you can have accelerated learning, and they are showing, and there is a huge demand for those schools. I get a little worried about it in terms of, but that is going a little too far. Just test it a bit, and if it is good, great. If it is not good, but get some research going, and then go ahead and implement it.
Miss Vyas, just to take the thought a little forward, given that
Right.
you've spoken a lot on it already.
Yeah.
Taking that idea that, while we figure out how do we teach children about AI, how do we also ensure that we are not, helping them deplete their NI, sort of natural intelligence, and if the coding jobs are not going to be there, how do we get our children to learn, like Sir said, conceptually more sound things, be more able to do lateral thinking, connect the dots that the world needs them to.
Yeah, no, thanks for that question. And I'm glad that we have Vineet here and his voice is there to keep caution on AI because, while there is optimism in terms of what technology can bring, we need to be making sure that it is implemented with responsibility, and especially when it comes to kids. As far as, AI is concerned, I will take first a little different tack because we were also talking about skilling and jobs. Going back to where India is and the aspiration of India to grow, one part of who gets left behind is also the women, right? They do not have access to digital as much as men do. Even in terms of jobs, we know that women lose out their jobs when they, either they get married or perhaps they're expected to do more of household chores. And we had done research in about 5 states, and we realized that you can increase labor force participation, women wanting to come back to take on more jobs. And one of the greatest desires for them was to learn about digital as well as, and with digital comes AI skills as well. So at one end, digital can widen the gap, but at the other end, when given access to, and even with AI, women can lend their, again, experiment done with a partner of ours, which is Karya. Through voice-enabled services, women are able to get a lot more livelihood rather than saying, hey, AI will create that divide, right? It can help you bridge that divide as well. We know AI can even trigger creativity. It can also offer, you know, fields that are not naturally that were available, and that's true of technology as well. And even especially with farmers, since Vineet mentioned, even our experiments in states, whether it is the state of Maharashtra working in certain districts or working in districts within Andhra Pradesh, where, as well as Orissa, where districts, experiments have been done in districts and then taken to scale, where farmer advisories or advisory to extension workers is leading to better productivity for farmers. They're aware of their schemes. They're aware of, they are equipped to be able to manage pests and pest infest, within their fields much better than if an extension worker is to go to farmer one by one and give them knowledge about the either the services or the perils of climate or perils of pest. So I am in the camp. I'm actually in an optimistic camp where I think that technology and AI can help spur progress faster. But yes, it has to be with guardrails of responsibility, which is true of even financial inclusion. Digital financial inclusion has led to so many people coming into the formal economy, but at the same time there is consumer protection, protection against frauds that are a mandate of Reserve Bank as well as banking system. So I think both progress as well as awareness go hand in hand.
India, we typically talk about when the union budget is presented, everyone says, oh, the health allocation is limited. Sorry, did you hear that? Yeah. So in India, typically we discuss the budget allocations for health, education every year. And, there are these usual critics who will say that this is not enough, we should do more. But really, there's not enough focus on the quality of outcomes. And, just by building hospital buildings and school buildings, does not mean that we ensure that, we are getting good teachers, good nurses, good doctors, and patients are getting the care or students are getting the education they need. So how do we change the paradigm in terms of driving the focus away from spending alone to the quality of outcomes? One. And secondly, while we see a lot of pilot projects and pockets of success that some of the foundations, like all three of you are working on unique projects in your different parts of the country, how do we get them to scale to a level where they can be nationally replicable? So if you could sort of take this two-pronged question. Mr. Dhawan, you want to start?
Sure. So, firstly, I believe that the budgets are sufficient for now. I mean, look, at the end of the day, we have a fiscal constraint. We're trying to reduce fiscal deficit. Our tax to GDP ratio is still quite low. Honestly, at this stage, we need to overinvest in capital expenditure and a stimulus to economic growth, like what production-linked incentives and other things do. So I'm a believer that we are far from the efficient frontier with the current money we spend. Right? It's extremely suboptimal. So that money will grow at some modest rate, but we need to become much more efficient and focus much more on outcomes, and take the fiscal budget and push it in a certain direction. As far as foundations working on their own little corner of the world, I think that's true, but I think that's changed in the last decade. In the last decade, government has been much more open to inviting partners from the outside to work with them much more systemically. So we care less about having our name. It's more about working with the system to improve outcomes. And given that education and health are both state subjects, you've got to work at state level. There's some policy stuff you can do at the center. I find that there's great degree of openness to working at state level, and many of us, all three of us actually, are working systemically as opposed to just working with a few schools and really looking to build the capacity of the system eventually.
Right. So we hope to see those scale up at a level where.
Yeah, I agree with what Ashish is saying from a budget point of view and the other comments. See, look at how did IT industry scale? IT industry scale when CML level 5 quality came in, and there was one way of developing the software. So everybody adopted one way of doing it. It was simple, it was easy to implement, and it was easy to replicate, it was easy to train. So if we want to transform healthcare, if we want to transform education, we have to simplify what we do, and we have to find out the most effective way, the most effective pedagogy, the most effective digital intervention, the most effective teacher training, and the most effective within the resources and constraints we have, the most effective technology intervention, the most effective enrollment increases, the most effective gamification of content, all that stuff. Once we identify that, then we have to simplify its implementation so that there is only one rule that the statistics is very clear. Only 19% of a teacher's time goes in teaching. 81% goes in other administrative activities. How do we get learning outcome from that 19%? How do we reduce the 81% and put some of that back into 19%? So if we have one way of doing it, various experiments, CSF, us, Gates Foundation, various experiments, and standardize and saying, okay, copy, paste, implement, and do that in a simple way across the state, across the country, I think it is solvable within the resources we have. But one way of doing it and the most effective way of doing it.
Ms. Vyas.
Like others, we work very closely with the government. It's not. It is complementary to what the government does, but within the system. As Ashish mentioned, budgets are enough. We are like the government, they have their own outcomes, they have their own health goals, education goals. We are working in tandem with those goals. Track outcomes as an organization, data tends to be our DNA, data tends to be government's DNA as well. We are tied up to those outcomes. These outcomes tend to be bound by certain timelines. Of course, timelines may move further. It's not, everything is not necessarily in your control, and you're not able to deliver. Sometimes you're not able to deliver to those goals within those timelines. But at the same time, I think data is great in terms of giving you feedback in terms of what's working, what's not working. We adjust our pilots, we adjust programs working with the government depending on the data that we see and what's most effective and what's not effective. You adjust for that. But I think at a high level, what I'd like to say is whether it's the Niti Aayog's program, which is looking at aspirational districts or blocks, it's very, very, it is outcome driven, right? You do measure in terms of what's working and what's not working, number one. Number two, I think as the scale question is that India has delivered scale across programs. Look at the digital public infrastructure, interoperable, open system, which is now yielding results for financial inclusion, education, agriculture, health, across sectors, right? That is replicable, and that replicability does not mean that it moves from state to state, but it can also be replicated across boundaries, right? DPI can be diffused and is being diffused not only, to South and Southeast Asia. There are other countries that are looking at India, they're looking at other countries like Singapore, LATAM, and replicability comes from how you think about systems and system design. And the third thing that I would say is that we've been working in the country for more than 25 years now. We are learning lessons ourselves. Hard states like Bihar, hard states like Uttar Pradesh, where we are seeing progress on health, we are seeing progress as far as education, and working with Central Square Foundation and UP, great results, which we think can be replicated and diffused in Africa. That's another continent where we work quite deeply, and we would be happy to take those lessons working with our partners to other countries as well.
So, I mean, this is sort of tangential question, but I know we're running out of time, but I wanted to ask you this because it's critical and I think it's often overlooked in the social infra context, what are the things that we can do to improve our women's labor force participation rate? The reason I'm asking is, like we said at the start, getting women to be financially secure, independent, is a great way to ensure that they do not rely on men who don't tend to make good choices compared to the women in our lives. And Therefore, they take better care of their children's education, their children's healthcare, the other development parameters, and therefore we create a virtuous cycle. Because if you have a high women's LFPR, women are independent enough to take better decisions. We'll hopefully have better civic sense in this country going forward. So, what can we do to get that sort of virtuosity going? I mean, maybe Mr. Dhawan can start it. All of you can weigh in.
Yeah, so I think that there are a few things. One is, I think the good news is that from an education standpoint, girls are doing better than boys, and young women, today the gross enrollment ratio in college is higher than that of men, young men. It crossed, or that those lines crossed each other almost 7-8 years ago. And I think the social barriers have come down. I mean, there are still parts of the country where there is patriarchy is dominant. They don't want their girls to work. But the social norms have changed a lot in the last decade. So we have to think hard about why, despite that, our female labor force participation now is in low 40s. But a lot of it is because of we count agriculture now properly, and so what was actually in the mid-20s went up to the low 40s. Formal participation is women are only 18% of the formal workforce. And in sectors like manufacturing also, women are in the teens in terms of participation in the labor force. If you look at the top 2,000 companies in India, listed companies, there are 12 million workers, 2 million are women. So again, about 18% women. So women should be holding up half the sky, as Mao said. So I think there are a few things. One is we need better enabling conditions. So safe housing, particularly if you look at industrial sites, the reason it happened in China is because you had dormitories in industrial zones. Government finally has a scheme which has been launched for industrial housing, to subsidize industrial housing. I think that's very critical. So safe housing is critical, safe transport. Otherwise, women will only want to work within a radius around their home where it's safe. Or at night, if they're going to work, make sure their safety is available. Creches, we really haven't done enough. The child goes to Anganwadi, it's for a couple of hours. They go to school, in primary school, it's for a few hours. You really don't have enough coverage unless you're in rural India and you have your parents around, you really don't have the ability to go out. So if you look at places like Vietnam, the schools are open till 5 p.m. And a parent is able to work the whole day and then go pick up their child from school. So I really think we have to look at this creche school infrastructure. So these are a bunch of enabling conditions that make it easier for women to participate in the work. Otherwise, they'll want to stay at home to take care of the child if the child's going to be back at 1 p.m. or 2 p.m. And then finally, I think on the demand side, companies also need to have belief that women can take on certain roles. I mean, when we talk to, for instance, in the pharma sector, only 11% of the workforce is women. They have this belief that women cannot do a sales job. Because sales job, you have to move around, go from medical rep to medical rep. It's not true. There are companies like Dr. Reddy's where 25, 30% of the workforce are women. Or that women can't do certain jobs in, say, warehouses. Amazon runs a warehouse where 100% are women. So I think corporate sector has these beliefs that are, and showing them these case studies or exemplars, and showing that many job roles where they thought women couldn't work. There were also laws that, by the way, prevented women. So now this Somanathan committee had come up with deregulation. So one of the first things they worked on was women being able to work at night. It already happened in IT, BPO, but if you looked at many sectors, women were not allowed to work at night. Many sectors were deemed as hazardous, and women were not allowed to work in these hazardous sectors, which were not really hazardous. So all of that has been removed. So I think, companies need to do things differently. The laws have changed, they need to change further. And then we need these enabling conditions for more women to be able to participate in the workforce.
Nair and Ms. Vyas, you want to add to this?
So 2 points complementing what Ashish has said. One is that most of the women are in informal sector. right? So they are, so one, that they are perhaps entrepreneurs, right? I mean, but they need to be given access to better credit. And the credit system is such that you will need a collateral. Well, she will not have a collateral, right? So products that will allow her to get access to credit and then access to market as well. How do you enable a woman entrepreneur to get to the market? Digital platforms now allow that to happen, but at the same time, they need to be, they need to learn, they need to be taught, they need to be taught about their safety. And then like any other entrepreneur, you would need mentorship. They need to understand marketing. So there are many barriers, but if that's where the market is. It is about making them better entrepreneurs, making them more productive in terms of their labor force participation as well. Otherwise, they keep falling off because, think about myself. I'm here as a woman. Actually, I have it a lot more easy because I'm in formal economy. I'm actually working in an organization. You ask me to become an entrepreneur, you will suddenly make it so hard for me. It's easy for me to get into a job. So therefore, education really helps because it'll help more women to come into formal participation. Otherwise, informal is hard. But at the same time, I think there are, again, with the government, the programs of Lakpati, Didis, NRLMs, self-help groups, FPOs were spoken about in your previous panel as well, where a lot of women are there. There are institutional structures that are being put in place, but for the economy to grow and for more women to come in, a lot more needs to be done. That I would acknowledge. Norms have to be shifted as well, but a lot more to be done there.
Final word on this. You've been an
Yeah,
employer
so
with
I
a large
agree with
workforce.
what has been said so far. I'll just add a couple of more points from a perspective. Number one, I strongly believe this vocabulary that percentage of women in workforce is a wrong vocabulary. I think the women working at home should be celebrated more in this country because without my wife taking care of the children when she did and she was not working, I would have not done what I did. So it is a 50-50 partnership, and it is very important to celebrate those women. And women should not be a working woman is not better than a non-working woman. I mean, that mindset we need to go. Number two, it is very important to approach as HCL in IT industry. We approach the fact that research showed that diversity in a team leads to better performance. And I think we need to constantly push that envelope. Not that we should have more women. Why should we have more women? No, because we should have more women because it is going to make you more profit, more bonus. So therefore, that research, and which is the reason the diversity equation in HCL and in IT industry really went up when we showed them the research that the more diversity, the better the performance, the better the quality, the more happier the people, the higher the satisfaction. That's the second part. Now, but there's some policy changes. Why don't we force the husband to take a 3-month off, not a 6-month off when the child is born? So some kind of things that the child is born and the woman gets 6 months off. No, why doesn't the husband get 3 months off, right? Some policy change. I think there is a mindset change which is needed here to recognize and reward the woman for the work she does, which is not in the employment, and to make sure that more and more men take responsibility of what is happening at home. With that happening, I think you will see more and more contribution to the economic growth directly by being employed or indirectly by supporting somebody who's employed.